Caitlin. I'll be your discharge nurse today.
Nice to meet you.
Nice to meet you. All right, can I get your name and date of birth?
Yeah, I'm Jax Perwins, and my date of birth is 2/18/83.
All right, great. I'm going to go ahead and take out your IV and discuss some of the discharge information that we'll have before you discharge today. Who do you have with you here?
Oh, this is my husband. He came to pick me up today.
Oh, hi, husband.
Yeah.
Nice to meet you. You look like a good driver, so I'm glad that she has you to help her.
And it was nice of him to take time out of work today. We were going to get
I see.
so.
He just came straight from work. So
Yeah.
that's wonderful.
Exactly.
Thank you. I appreciate your service. All right. So to begin with, we're not going to discharge you with any medications, but if you have any pain or anything, you can take some over-the-counter acetaminophen.
Okay.
Do not exceed 3,000 milligrams in a day. So you're going to have to take care to make sure you're paying attention to what your dose is.
Okay.
But also know that if you're taking any combination pain meds, that sometimes cold medicines, they can have acetaminophen in there. So be
Good to know. Okay.
sure to read the labels.
Okay.
Don't exceed 3,000 total milligrams.
Okay.
Also, stop taking it if you notice any rash or fever or muscle or joint aches. Those are signs of a reaction you could be having to it, so stop taking it.
Okay.
I'm assuming you've taken Tylenol before, though.
Yeah,
so-
yeah. I didn't know that those reactions could occur though.
Yeah.
Is there like a paper that I'll get so that I
Absolutely.
can make sure I remember those? Because
Thank you for asking. I have your discharge paperwork right here.
perfect.
All
I'll
right,
have
you
to
can
use
just
that.
follow along with me.
All right.
That's great. Okay, perfect. Also, we just, with the prepping for the procedure, you kind of wiped out your gut microbiome. So you can also take some kind of probiotic supplement if you wanted, or even better, probiotic foods.
Okay.
Kefir, kimchi, kraut, yogurt, anything like that will help repopulate your gut microbiome, and that will also help your digestion.
Okay. So Greek yogurt is good.
Great choice.
Okay,
Yeah,
perfect.
100%. Okay, speaking of that, you can go back to your normal diet.
Yeah. Does that include like I can go to EG's and get some chicken tenders because my kids had them last week and I just haven't had a craving ever since, and I was really looking forward to it after this.
How about tomorrow?
Okay.
Because-
So not immediately jumping.
Yes.
Okay.
Today, let's stay away from fatty foods and
Oh,
spicy
okay.
foods and foods that are going to irritate your stomach
That
and
makes
your
sense, okay.
digestion. So bland, like kind of stick with some bland foods, maybe some saltine crackers, graham crackers. You could do white rice, that's fine. White bread, avoid seeded bread. That's something that you don't want to put in there quite yet.
Okay.
You can do lean protein though, so you can have like
Oh, okay. So you have like grilled chicken and some chicken tenders.
Absolutely.
Okay.
some
Sounds good.
non-fatty fish, something like that. Just stick with lean protein for today.
Okay.
Give your body a chance to get going again.
That makes sense.
Also, though, make sure to drink plenty of fluids. Lots of water. You can drink electrolyte drinks. That's okay, because your electrolytes in the cleaning process could
Yeah.
have been.
I lost a lot.
Yeah.
Okay.
Also, if you feel like you can't drink that much, you can also focus on having some liquid foods.
Okay.
Applesauce, some mild soups,
Okay.
vegetable juice, fruit juice. Those are okay also to get some calories, but also to get some food and some liquid together.
Okay.
All right. A little bit of activity restriction. Please do not go straight to the gym.
What? But it's thrusters today, and I have my cutest gym out.
I know you do, and you look great,
Oh,
but you
all
were
right,
just
all
sedated.
right. Okay.
So-
that makes sense, I guess.
You could hurt yourself, and then you won't be able to go to the gym for a really long time.
Well, when you put it that way. All right.
Yeah. So take it easy today. Go home, sit on the couch, watch some friends,
Okay.
have your husband take care of you and your
I guess
children.
that sounds okay.
Foot massage. Refrain from operating heavy machinery.
Okay.
You know.
So you should be the one to drive home then?
Absolutely.
Okay.
That's. I'm glad he's here for you for that.
Perfect.
Also, don't make any really important financial decisions or really important decisions today for
Okay.
the rest of the day. Just take it easy. You can resume your normal activities gradually, but you're going to want to avoid that strenuous exercise. Okay, that's
so
important.
ease back into my
Yes,
gym days.
ease
All
back
right.
into your gym days. Very good.
I can do that.
For follow-up care, your provider should let you know when to expect the results, but when he does give you results, if you need to be seen by a follow-up, please make that appointment. And sometimes their office can actually help you make that appointment when they give you the information. So, again, avoid making legal decisions. To ease any kind of potential abdominal discomfort, have you noticed any bloating or?
I've actually been passing gas quite a bit already.
Wonderful.
Just commenting on that.
Yes.
But you know, it's what happens when you're married, so.
Right. So they fill you full of air to navigate the scope through your
See,
intestines?
It wasn't just me. All
No,
right.
it's not just her.
Okay.
That's normal.
Okay.
But if you have any severe abdominal pain, that's something that you're going to want to contact.
Okay,
the
so like
provider
if
for.
passing gas isn't making it go away.
Yes, that's
Okay.
important. But if you do have that gas, walk around. That should help, stimulate the gas to move down.
Okay.
Lie on your left side. That will also help. Let's see. see. So there are some situations where you may need to contact your provider or go to the ED. So you might, when you have your first bowel movement, you might notice a little bit of blood. That's okay. They probably took some biopsies, and you might have a little bit of residual blood. But if you have bright red blood that is coming out of you, that is, go to the ED, contact your provider.
Okay.
Also, black tarry stools, you want to contact your provider. That's important.
Okay.
If you have any signs of sepsis or like a systemic infection, so high fever, 101 degrees or more, chills, weakness, fast heart rate.
Okay, yeah, I've heard of that.
Yeah, so or confusion, definitely go to the ED immediately.
Okay.
Severe or persistent abdominal pain, more than just the bloating, you want to make sure you contact your provider.
Alright.
Any abdominal distension that can't be relieved by burping or passing gas. And then if you don't have a bowel movement for 3 or 4 days, contact your provider.
Yeah, that doesn't sound good.
No.
Okay.
The IV site, just take care of that as well. Make sure you look for signs of infection on your arm as well. But other than that, do you have any questions for me?
No, I think you answered it all, and this is great. I'm gonna have to take notes, so thank you.
Perfect. All right, great. Well, I hope you have a great day
Thank
and
you.
take care of yourself.
All right,
Bye.
thanks.